Our experimental design tests the difference in survivorship between urban and rural communities. In this presentation, we will discuss associated background information, associated figures, the question and hypothesis that the experiment is centered around, the methods and parameters for the experimental design, and the results of the data collection. Several organizations have researched the consistent poor quality of healthcare in rural areas. Rural areas generally have a higher utilization rate per capita compared to larger city hospitals, paired with other factors such as a small number of board-certified physicians, fewer hospital beds, fewer contracts with insurance companies, and many more things. This affects the quality of healthcare that people living in rural communities receive at their local hospitals. This leads to a higher rate of death from specific diseases compared to urban areas. Furthermore, lack of risk management amongst rural communities leads to higher numbers and avoidable deaths. In this figure, we can see that the rate of heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke are consistently higher in rural communities. Here you can see that there is a higher incidence rate of cancer, which is a reflection of both genetic and cultural phenomena that may be factoring into the decreased survivorship in individuals living in rural communities. This particular study shows that the rate of decline in preventable cancer diagnoses in rural areas was slower. Across many studies, it can be seen that the rural areas have higher rates of death from a lack of preventative care and resources. Additionally, the mortality rate amongst rural communities and rural residents is much higher than people in urban areas. One factor that contributes to this is the high unintentional death rate. This trend also elucidates the lack of risk management amongst rural communities, making it more likely for them to engage in risky behavior such as driving under the influence. This can be seen in the motor vehicle accident incidents chart seen here. So consistently, the rural communities have had a higher number of deaths due to motor vehicle accident. This leads us to our question. How does rural versus urban living affect survivorship amongst adults? Compared to the metropolitan areas in the United States, rural areas have less access to outside resources, which in turn leads to having a higher rate of common life-threatening lifestyle choices, thus leading to decreased survivorship. Essentially, our hypothesis is stating that there will be decreased survivorship among rural communities compared to urban communities. The first step in our experiment is to collect data from selected cemeteries. Then we will collect data on 100 individuals in rural and 100 individuals in urban communities. After that, we will construct a population pyramid and a survivorship curve. To see if our hypothesis is correct, we will be using a t-test on the data collected. To decrease outside influences, we will only use specific types of people. We will not use children in order to decrease the influences of parental figures. We will not use families to decrease genetic characteristics that may exist in a bloodline. We will not use veterans to decrease the number of associated diseases that come from war. And we will only use individuals who died after the 1960s to make sure all of the selected individuals had access to a certain level of quality of healthcare towards the end of their life. We decided to use states from different regions in America to include a wide variety of regional differences. We will use one urban and one rural area from each state. Based on census categorization of rural and urban, we decided that anything around 3,000 people in a community is considered rural, and anything greater than 5,000 is considered urban. Each city had to have enough data to provide 25 individuals for urban and 25 individuals for rural. The four states we chose were Colorado, Texas, Maryland, and California. Each state had one rural and one urban city that we chose, except for Colorado. In Colorado, the cemeteries in the rural communities did not have enough data to provide sufficient amounts of individuals for the experiment. So we decided
So, after all that data collection, here are the results that we obtained. Using our data, we first made a population pyramid that shows both the range and distribution of deaths in each age interval. In the pyramid, we can see that the rural population has a wider range of deaths, meaning people are dying at both a younger and an older age. This could be related to lack of resources, and other socioeconomic disparities that exist between the urban and rural communities. The curve for the rural population also varies compared to the urban population, which could be due to instability in healthcare and other cultural differences. Going back to the higher number of deaths in the younger population in the rural community, it can be related to the cultural difference and low quality healthcare systems and more accidents in the rural community. The next thing we did was construct a survivorship curve from which you can see the number of individuals surviving in each age interval. After we made it, we could see that it followed a typical type 1 survivorship curve. This means that we're looking at a species that primarily dies due to old age, a trend that is common in mammals, including humans, obviously. Both of our communities followed this trend, but the urban survivorship curve matches the standard curve more precisely, and the rural survivorship curve is lower than the standard and, most importantly, the urban curve. This could be due to the disproportionately higher number of individuals dying at a younger age in the rural community versus the urban community, again, due to various socioeconomic and healthcare issues. The difference between the urban curve and rural curve can also be due to the greater variance in deaths seen in the rural population. So we can conclude from looking at this survivorship curve that there is a clear difference in the survivorship of individuals in urban and rural communities. Last but not least, we conducted a t-test and found our p-value to be less than 0.00025, which is much lower than our significance level of 0.05. Using this value, we were able to reject the null hypothesis and accept the hypothesis that there is a significant difference between the survivorship of the two groups that we study, meaning there is a 0.025% probability that our results were due to chance, which is a pretty low number and is very reassuring. To further expand on the hypothesis, we could repeat our experiment using more states and cities across the US. We could also look at more cemeteries to collect data from each state, which would give us a wide range of data. An interesting experiment that we could do is cross-examine data collected in the US and compare it to other countries, for example, a developing country. We could also introduce a third variable of suburban neighborhoods and compare it to urban and rural populations. Nadia and I thank you for bearing with us, and we hope that you enjoyed our presentation just as much as we enjoyed doing the experiment.